We're now joined by Darrell K, who's president and CEO, and Dr. Eric Wasserman, chairman and medical director of emergency department at Newark Beth Israel Medical Center and Children's Hospital, New Jersey. Gentlemen, thank you so much for joining us.
Thank you, Steve. Thanks for having us.
Yes,
Darrell,
thank you.
I'm sorry for interrupting. Kick this off, Darrell. There's a $5 million grant that has come to your hospital, and it comes through the Healthcare Foundation of New Jersey. Specifically for what, and why does it matter so much in terms of serving the healthcare needs of the citizens of Newark, particularly the South Ward of Newark, one of the 5 wards in the city?
So we're super excited about this project. Newark Beth Israel Medical Center and the Children's Hospital of New Jersey is embarking on a $150 million plan to really change the face of Lyons Avenue in the South Ward of Newark. It is the singular largest investment in the South Ward in a significant period of time, certainly the largest investment in Newark Beth Israel in well over 50 years. The Healthcare Foundation of New Jersey, which has partnered with us on a number of initiatives, have generously committed $5 million towards this project, specifically naming the Healthcare Foundation of New Jersey Emergency Services Pavilion. The emergency department is certainly our front door of our medical center and how many people interact with the hospital. And so having that significant presence on Lyons Avenue in a new expanded emergency department is super exciting and worthwhile for our community.
Doctor, talk about that, because some of us who are born and raised in Newark know Lyons Avenue well, but it is not just for Newarkers. It is an example of what could be in urban centers across this country. It's also not healthcare. We're talking about the economic development aspects in a second, Darrell. But Doctor, talked about the impact on serving patients, particularly in the underserved community in Newark.
Yeah, so this is really wonderful for our community and for patients that we get from all over the country that come to Newark Beth, really. But specifically, our catchment area is right around the hospital, and day in, day out, we take care of our community primarily, and this expansion and kind of facelift that we're getting is really critical to delivering, the high quality care that Newark Beth is known for.
Darrell, you and I have talked many, many times. Your connection to the Beth is not just being the leader there, but it's very personal. Connect that to this conversation about the specific community we're talking about and the needs of this community. I'll complicate the question for you, my friend, particularly at a time when vaccine resistance, COVID vaccine resistance in the African-American community is much higher than it needs to be, and even though there are legitimate reasons for some of that resistance, your connection to this community and why it matters so much, particularly now.
So as you and I have talked about many times, Steve, I was born at Newark Beth Israel Medical Center. I met my wife here. My 2 youngest kids were born here. My granddaughter was born here. My brother died in this hospital, my grandparents. So it is a very personal connection for me. So the work that I do here, that we do as a team, is personal. When we talk about, treating people like it's their family, oftentimes for me, it actually is my family. And so Lyons Avenue, the Beth has been an enigma in our community in previous years. It has a fortress-like appearance, and it's not very welcoming from the outside, although they have wonderful, great people on the inside. And so now the outside will consist of natural lighting and glass and transparency, and the entrance will be oriented to Lyons Avenue. So it is a connection to the community to say that we are a part of, and not some enigma or some strange, intruder. We're actually a significant anchor institution in the South Ward. And it also speaks to our commitment to being here. When you invest $150 million in something, you will be here. You will be here serving the needs of our community. And I couldn't be more excited about the interaction with the community.
By the way, the Beth is part of a larger healthcare system, RWJ Barnabas Health, a significant supporter of public broadcasting. Doctor, let me ask you this. And one of the challenges when it comes to serving people in the community that we're talking about. And by the way, you could be talking about urban communities across this nation, across the state, first of all, in Trenton and Atlantic City and Elizabeth, and et cetera, or in Philadelphia and other places outside. Access matters. How will this change access, Doctor?
Right. So, the aesthetics and the cosmetics of the job are only one piece of this. Operationally, we're going to be a much more efficient emergency department. The entrance, as Mr. Terry mentioned, is right on Lyons Avenue. Operationally, the geographic layout of the department will allow for team-based care, which really, upon arrival, which will result in decreased wait times for patients and shorter length of stays and increased safety. There's also improved communication between providers, physicians, and nurses because of the close proximity that everyone will be in based on the layout and the new structure of the department. It flows more efficiently, at least on the plans.
Darrell, let me follow up. I want to follow up, Darrell. And again, you and I have talked about this before. The vaccine resistance in the African American community, warranted for many reasons historically. The history, it speaks for itself. However, what specifically do you believe needs to be done, is being done, and needs to be done moving forward to increase the number of folks in the African American community and Black and brown communities who say, okay, I trust enough to do this, because we're never going to get where we need to get to if we don't succeed on that level? Darrell.
So it's really important to have a connection and trust to your healthcare facility. And then when situations like this occur, you already have that natural trust bond relationship. And so, there is hesitancy for sure, but it's not just hesitancy. There have been access issues that sometimes we confound with hesitancy, and the rollout of sort of the vaccine process and click this link and making appointments and trying to get through.
It was complicated and confusing, and
yes,
you can't just put it all on resistance. That's part of it. But if it's hard to pull off, people back off.
That's right. That's right. And so there are some hesitancy, and I believe that is directly related to misinformation that's on social media. Social media and some of the things that are coming out of there are literally killing people. And so what I've committed to do here at Newark Beth Israel, and what we've committed to do at RWJ Barnabas Health, is really give good, credible information by respected physicians to our community. We have had a series of webinars. I have met with dozens of groups of people to talk to them, with physicians with me, just to make sure, because I am not a physician, just to make sure that they had real credible information and that we would have the ability to answer any concerns that they've had. I've literally convinced hundreds of people that this is the right thing to do.
Still a lot of work to be done. Darrell, Terry, Dr. Eric Wasserman, I want to thank you so much for joining us. We'll continue this discussion. Thank you, gentlemen.
Thank you, Steve.
Thank you.
I'm Steve Adubato. Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, Prudential Financial, the Fidelco Group, New Jersey Sharing Network, the Robert Wood Johnson Foundation, the New Jersey Economic Development Authority, Rutgers University, Newark, Choose New Jersey, and by ADP. Promotional support provided by New Jersey Monthly and by Meadowlands Chamber.
I'm Tim Sullivan, CEO of the New Jersey Economic Development Authority. Since joining the NJEDA, I've been struck by the incredible assets and resources that New Jersey has to offer. The NJEDA is working every day to grow New Jersey's economy in a way that maximizes the values of those assets to benefit every single New Jersey resident. This includes more support for small businesses and a focus on reclaiming New Jersey's position as a leader in the innovation economy. Visit njeda.com to learn more about how NJEDA is building a stronger and fairer New Jersey economy.